What if the pill sitting in your medicine cabinet right now, the one your doctor prescribed months or even years ago, the one you take every single morning without a second thought, is quietly stealing your memory? Not slowly, not gradually, but rapidly. Here's a fact that will stop you in your tracks. Researchers at the University of Washington conducted a landmark study following nearly 3,500 seniors for over 7 years. What they found was alarming. Certain commonly prescribed medications taken by millions of American seniors every single day, were associated with a significantly increased risk of dementia. Some showed up to a 54% higher risk. And the most disturbing part? Many of these medications are considered completely routine. They are prescribed for sleep problems, allergies, bladder issues, depression, and anxiety, conditions that affect almost every senior over 60. Your doctor may have never once mentioned the word dementia when handing you that prescription, but today, I am going to, because you deserve to know. Stay with me. Hello and welcome back to the channel. If you are new here, I am so glad you are watching. This channel is dedicated to giving seniors and their families the honest, research-backed health information that too often gets left out of a rushed doctor's appointment. Today we are talking about something that affects millions of American families: medication-related cognitive decline and dementia risk in seniors over 60. Now, before we go any further, let me say something critically important. Please do not stop taking any medication after watching this video. I am going to say that again because it matters enormously. Do not stop taking any prescribed medication without first talking to your doctor. Stopping certain medications abruptly can be dangerous, even life-threatening. What this video is designed to do is arm you with knowledge, so that you can have an informed, confident conversation with your doctor and ask the right questions about whether every medication you are currently taking is still the safest and most appropriate choice for you at your age. Because here's the truth. Many medications that are completely appropriate for a 40-year-old become problematic for a 70-year-old. Why? Because the aging brain and body process medications differently. The kidneys clear drugs more slowly. The liver metabolizes them less efficiently. The blood-brain barrier, which normally protects the brain from chemicals in the bloodstream, becomes more permeable with age, meaning more of certain medications reach the brain directly, and some of those medications interfere with the brain chemicals responsible for memory, attention, and clear thinking. The result can look exactly like early dementia. In fact, medication-induced cognitive impairment is one of the most commonly misdiagnosed conditions in seniors over 60. People are told they have dementia, families grieve, plans are made for memory care, when what they actually have is a medication side effect that could be reversed. Let us go through all 9 medications now. Medication number 1, anticholinergic drugs. This is the category that appears in virtually every major study on medication-related dementia risk, and it is the one that concerns researchers the most. Anticholinergic drugs work by blocking a brain chemical called acetylcholine. Acetylcholine is one of the most important neurotransmitters in the brain. It plays a central role in memory, learning, and attention. It is also the exact chemical that is deficient in people with Alzheimer's disease. So when a medication blocks acetylcholine as a side effect, or as its main mechanism of action, it is essentially doing to your brain what Alzheimer's disease does, temporarily reducing the availability of the chemical your brain needs to think clearly and remember. Now here is what makes this so important for seniors. Anticholinergic drugs are found in an enormous range of common medications, many of which you would never suspect. Common antihistamines like diphenhydramine, which is the active ingredient in Benadryl, and also in many over-the-counter sleep aids like Zetazquil, Unisum, and Tylenol PM. Bladder medications like oxybutynin, sold under the brand name Ditropan, and tolterodine, sold as Detrol. These are prescribed for overactive bladder, extremely common in seniors. Certain antidepressants, particularly the older tricyclic antidepressants, like amitriptyline and nortriptyline, certain muscle relaxants, and some medications used for nausea and dizziness. The University of Washington study I mentioned in the opening found that people who took strong anticholinergic drugs for 3 or more years had a 54% higher risk of developing dementia compared to those who did not take them. 54%. That is not a small number. That is enormous. And the risk was dose-dependent, meaning the longer you took them and the higher the dose, the higher the risk. What should you do? Ask your doctor for a complete medication review. Specifically ask, do any of my current medications have anticholinergic effects? Are there safer alternatives for the conditions these medications are treating? For bladder issues, for example, there are newer medications with much lower anticholinergic activity. And for sleep, there are safer, non-pharmacological approaches we will discuss shortly. Medication number 2, benzodiazepines. Benzodiazepines are among the most prescribed medications in the United States, especially in seniors over 60. You probably know them by their brand names. Xanax, Valium, Ativan, Klonopin, Restoril. They are prescribed for anxiety, panic disorder, and sleep problems. And in the short term, they can be genuinely helpful for acute anxiety or crisis situations. But the research on long-term benzodiazepine use in seniors over 60 is deeply concerning. A large French study published in the British Medical Journal followed over 1,000 seniors for 15 years. They found that people who started taking benzodiazepines had a 51% increased risk of developing Alzheimer's disease. The risk was highest in those who took long-acting benzodiazepines, like Valium and Klonopin. Here's what happens in the brain. Benzodiazepines work by enhancing the effect of GABA, which is the brain's main inhibitory chemical, the one that slows brain activity. This is why they reduce anxiety and promote sleep. But in aging brains, this inhibitory effect can be too strong. It suppresses the neural activity needed for memory consolidation, for learning, for clear thinking, and over time, chronic use changes the brain's own ability to regulate itself, leading to lasting cognitive effects. Many seniors have been on benzodiazepines for years, sometimes decades, often because stopping them causes withdrawal symptoms that mimic anxiety, making it feel impossible to stop. If you are on a benzodiazepine long-term, please talk to your doctor about a gradual, supervised tapering plan. Stopping abruptly is dangerous, but a slow, carefully supervised reduction is often possible. And for many seniors, cognitive function improves significantly when these medications are carefully discontinued. Medication number 3, proton pump inhibitors. Proton pump inhibitors, known as PPIs, are among the most widely used medications in the world. Brand names include Nexium, Prilosec, Prevacid, and Protonix. They are prescribed for acid reflux, GERD, and stomach ulcers, and they are also widely available over the counter, which means millions of seniors take them daily without any medical supervision. The concern with long-term PPI use and cognitive decline comes from several mechanisms. First, PPIs have been shown to interfere with the production of vitamin B12. By reducing stomach acid, they impair the absorption of B12 from food, and B12 deficiency is one of the most common and most reversible causes of cognitive decline in seniors. Low B12 causes confusion, memory problems, and changes in personality that can be mistaken for dementia. Second, animal studies have suggested that PPIs may directly increase levels of amyloid beta in the brain, the protein associated with Alzheimer's disease. Third, a German study published in JAMA Neurology found that regular PPI users had a 44% increased risk of dementia compared to non-users. Now, this is an area where research is still evolving. Not all studies show this association equally strongly, but the consistent finding of B12 deficiency alone is reason enough to have a serious conversation with your doctor. What should you do? Ask your doctor if you truly still need your PPI. Many people start them for a temporary problem and remain on them for years unnecessarily. Ask about B12 testing and supplementation if you are a long-term PPI user. And ask about alternatives like H2 blockers for milder symptoms, or dietary and lifestyle modifications. That might reduce your need for acid suppression medication altogether. Medication number 4, statins in specific high-risk populations. Now this one is nuanced, and I want to be very careful how I present it, because statins, medications that lower cholesterol, have genuine documented cardiovascular benefits for many people. They reduce heart attack and stroke risk. And for many seniors, that benefit is real and important. But a subset of patients, particularly women over 70 and people with certain genetic variations in how they metabolize statins, experience statin-associated cognitive side effects. These include memory problems, difficulty concentrating, confusion, and what many patients describe as feeling mentally foggy. The FDA itself updated statin labeling in 2012 to include cognitive impairment as a known side effect. The proposed mechanism involves statins reducing cholesterol in the brain. Your brain is actually made up of about 25% of the body's total cholesterol, and cholesterol plays a critical role in maintaining the myelin sheath, the protective coating around nerve fibers that allows signals to travel efficiently through the brain. When brain cholesterol drops too low, signal transmission can be impaired, leading to cognitive symptoms. The good news is that statin-related cognitive symptoms are generally reversible when the medication is stopped or changed. If you are on a statin and have noticed memory or cognitive changes since starting it, please discuss this with your doctor. Do not stop it on your own, but do ask, could this statin be contributing to my cognitive symptoms? Is a different statin, a lower dose, or a medication holiday warranted? Before we continue with the remaining 5 medications, I want to speak directly to you for a moment. If you are over 60, or if you are caring for an elderly parent, a spouse, or a loved one, what we are discussing today could be genuinely life-changing. Medication-related cognitive decline is one of the most commonly missed diagnoses in senior medicine. Seniors are told they have dementia. Families grieve. Plans are made for memory care, when the real cause is sitting in a pill bottle on the kitchen counter. If this video is opening your eyes, please take a moment to hit the like button and subscribe to our channel. We share life-changing senior health information every single week. And please share this video with someone you love who is over 60. It could change everything for them. Now let us continue. Medication number 5. Sleep medications, including Zolpidem. Zolpidem, better known by its brand name Ambien, is one of the most prescribed sleep medications in the United States, particularly in seniors over 60 who experience sleep difficulties. The American Geriatric Society has placed Zolpidem on its Beers criteria list. The Beers criteria is a list of medications that are considered potentially inappropriate for use in older adults. Zolpidem is on that list for several reasons. It increases fall risk significantly. It causes next-day sedation and cognitive impairment. It can cause complex sleep behaviors like sleepwalking and sleep driving. And with long-term use, it is associated with lasting cognitive effects. A Taiwanese study following over 5,000 seniors found that Zolpidem users had a significantly higher risk of developing dementia compared to non-users. The mechanism is similar to benzodiazepines, excessive suppression of brain activity during deep sleep when the brain actually needs to be active for memory consolidation, and the glymphatic cleaning process. What are safer alternatives? Cognitive behavioral therapy for insomnia, known as CBTI, is now the gold standard first-line treatment for insomnia. It works better than medication in the long term, with no side effects. Low-dose melatonin, particularly a slow-release formulation, can help regulate the sleep-wake cycle. And sleep hygiene practices, consistent bedtimes, dark rooms, reduced screen exposure, and morning light exposure all make a meaningful difference. Medication number 6. Certain blood pressure medications. High blood pressure is extremely common in seniors over 60, and treating it is genuinely important for brain health. Uncontrolled high blood pressure is itself a major risk factor for dementia, but certain specific blood pressure medications, particularly the older generation of beta blockers, medications like propranolol and atenolol, can cross the blood-brain barrier and in some patients cause cognitive side effects, brain fog, depression, fatigue, memory difficulties. The blood-brain barrier in seniors over 60 is more permeable than in younger adults, meaning more of these medications reach the brain directly. Not everyone on beta blockers experiences cognitive side effects. Many people tolerate them very well, but if you are on a beta blocker and have noticed mental fogginess or memory changes since starting it, this connection is worth discussing with your doctor. Newer, more selective beta blockers or alternative blood pressure medication classes, like ACE inhibitors or certain calcium channel blockers, may actually have neutral or even protective effects on brain health. The key message is not to stop your blood pressure medication. Uncontrolled blood pressure is genuinely dangerous for your brain. The key message is to have a conversation about which specific medication is best for both your heart and your brain. Medication number 7. Opioid pain medications. Opioid pain medications, including hydrocodone, oxycodone, morphine, and tramadol, are frequently prescribed to seniors for chronic pain conditions, arthritis, back pain, post-surgical pain, and cancer-related pain. And in certain contexts, they are genuinely necessary and appropriate. But long-term opioid use in seniors carries significant cognitive risks. Opioids bind to receptors throughout the brain and nervous system, including receptors in areas critical for memory and executive function, the prefrontal cortex and the hippocampus. Chronic opioid use in seniors has been associated with impaired attention, memory difficulties, slowed processing speed, and increased delirium risk during hospitalizations. Additionally, opioids suppress the sleep architecture, reducing the amount of deep restorative sleep, which, as we have discussed, is when the brain cleans itself and consolidates memories. Many seniors on long-term opioids are caught in a cycle, where the medication impairs sleep quality, which worsens pain sensitivity, which leads to higher opioid doses, which further impairs sleep and cognition. If you are on long-term opioids and have noticed cognitive changes, ask your doctor about a pain management review. There may be non-opioid alternatives, physical therapy approaches, or interventional pain procedures that could reduce your opioid burden while maintaining pain control. Medication number 8, certain antidepressants. Depression is extremely common in seniors over 60, and treating it is important. Untreated depression itself is a risk factor for cognitive decline and dementia, so antidepressants can be genuinely beneficial and even protective for many seniors. But certain antidepressants carry more cognitive risk than others, specifically the older generation of tricyclic antidepressants, including amitriptyline, sold as Elavil, nortriptyline, and doxepin. These have significant anticholinergic activity, which, as we discussed in medication number 1, directly impairs the brain's memory and learning systems. They also have sedating effects that can compound cognitive impairment in seniors. Newer generation antidepressants, particularly SSRIs and SNRIs, medications like sertraline, escitalopram, and duloxetine, generally have much lower anticholinergic burden and are considered safer for cognitive health in seniors. If you are on an older tricyclic antidepressant for depression, pain, or sleep, ask your doctor whether a safer alternative might work equally well for your condition, with a significantly lower cognitive risk profile. Medication number 9, corticosteroids used long-term. Corticosteroids, including prednisone, prednisolone, and dexamethasone, are powerful anti-inflammatory medications prescribed for a wide range of conditions: rheumatoid arthritis, lupus, asthma, chronic obstructive pulmonary disease, inflammatory bowel disease, and many others. Short-term use of corticosteroids is generally manageable for most people, but long-term corticosteroid use in seniors over 60 carries significant risks for the brain. Corticosteroids cause elevated levels of cortisol in the body. Cortisol is the body's primary stress hormone, and chronic elevated cortisol is directly toxic to the hippocampus, the area of the brain most critical for forming new memories, and the area that is most severely damaged in Alzheimer's disease. Animal studies have shown that prolonged corticosteroid exposure actually shrinks the hippocampus, reduces the number of neural connections, and impairs the formation of new memories. In humans, long-term corticosteroid use has been associated with mood changes, memory difficulties, difficulty concentrating, and in some cases more significant cognitive decline. Additionally, corticosteroids raise blood sugar levels significantly, and elevated blood sugar over time is independently associated with increased dementia risk. What should you do if you are on long-term corticosteroids? Ask your doctor whether the underlying condition can be managed with steroid-sparing alternatives, disease-modifying anti-rheumatic drugs for rheumatoid arthritis, for example, or biological medications that can reduce inflammation without the cortisol-elevating effects of steroids, and ask about the minimum effective dose. Often the dose of corticosteroids can be reduced over time as the underlying condition comes under better control. Now let us talk about what you can actually do with this information. Because knowledge without action is just worry, and I do not want to leave you worried. I want to leave you empowered. Here is a practical step-by-step action plan. Step 1. Write down every single medication you currently take, every prescription drug, every over-the-counter medication, every supplement and herbal product, and the dose and how long you have been taking each one. Step 2. Schedule a medication review appointment with your primary care doctor, not just a regular checkup. Specifically request a medication review, and bring your complete medication list. Step 3. For each medication on your list, ask these specific questions. Do I still need this medication? Are there safer alternatives for my condition at my age? Does this medication have anticholinergic effects? Does it affect cognition, memory, or sleep quality? What are the risks of continuing this medication long-term at my age? Step 4. Ask for a simple cognitive assessment. Tests like the MMSE or MOCA are brief, non-invasive memory tests that can establish a baseline and help track whether cognitive function changes over time. Step 5. Ask about B12 and vitamin D levels. Both are extremely commonly deficient in seniors. Both cause reversible cognitive symptoms, and both are easily and cheaply corrected with supplementation. Step 6. Focus on the lifestyle factors that genuinely protect brain health. Regular aerobic exercise is the single most powerful tool known to science for protecting the aging brain. Even 30 minutes of brisk walking 3 to 5 times per week makes a measurable difference. Social engagement, mental stimulation, quality sleep, a Mediterranean-style diet rich in vegetables, olive oil, fish, and whole grains, and management of cardiovascular risk factors like blood pressure, blood sugar, and cholesterol. These are not glamorous solutions, but they are evidence-based, and they work. Let us quickly recap the 9 medications that have documented associations with cognitive decline and dementia risk in seniors over 60. Number 1. Anticholinergic drugs including Benadryl, bladder medications, and older antidepressants. Number 2. Benzodiazepines including Xanax, Valium, Ativan, and Klonopin. Number 3. Proton pump inhibitors including Nexium, Prilosec, and Prevacid. Number 4. Certain statins in specific high-risk populations, particularly women over 70. Number 5. Sleep medications including Ambien and other zolpidem products. Number 6. Certain blood pressure medications, particularly older beta blockers that cross the blood-brain barrier. Number 7. Long-term opioid pain medications including hydrocodone and oxycodone. Number 8. Older tricyclic antidepressants including amitriptyline and doxepin. Number 9. Long-term corticosteroids including prednisone and prednisolone. Remember, do not stop any of these medications on your own. Have an informed conversation with your doctor. Ask the right questions, explore safer alternatives, and advocate for healthcare that considers both your immediate condition and your long-term brain health. To every person watching this, whether you are a senior managing your own health or an adult child watching on behalf of someone you love, you have just armed yourself with information that could genuinely change a life. Memory loss does not have to be inevitable. Not all cognitive decline is Alzheimer's disease. Not all confusion is irreversible. Sometimes the answer is in the medicine cabinet, and sometimes asking one honest question of your doctor opens a door that changes everything. You deserve clear thinking at 70. You deserve a sharp mind at 80. And you deserve healthcare that protects your brain. With the same diligence it protects your heart. Fight for that. Ask for that. You are worth it. If this video opened your eyes and gave you information you wish you had known sooner, please give it a thumbs up right now. It helps our channel reach more seniors and families who desperately need this information. Subscribe to our channel and turn on the notification bell so you never miss our weekly senior health videos. And please share this video with your parents, with your spouse, with your siblings, with anyone over 60 who takes multiple medications. This could literally be the most important video they watch this year. Drop a comment below and tell me, are you or someone you love currently taking any of these 9 medications? Has anyone in your family been told they have dementia when it might actually be medication-related cognitive decline? I read every single comment, and your story could change someone else's life. Thank you so much for watching. Stay informed, stay empowered, and I will see you in the next video.